Um, and I think also let's talk about securing health services. Now, what's more important than healthcare services? How do we really ensure that it continues to run? We're already seeing hospitals overrun in wealthy countries suffering extremes. And how can developing countries prepare? First up, we need to focus on independent and sustainable energy supplies that are powerful enough to run whole facilities such as hospitals and all emergency services providers.
Yeah. So because I spent a lot of time in the hospital, we had a couple of electricity outings,
Mm-hmm.
and that was kind of like, whoa. Now my husband wasn't on machines that if they had turned off, he would have died. But I'm sure there were people. So here's the challenge: energy sources currently in use. Firstly, are the electrical grids, which we've discussed are at risk of breaking down, followed by generators running on fossil fuels. So I asked the question, when does it get too hot to run a generator? And apparently that number is anywhere from 40 degrees Celsius. So the heat and humidity combination is lethal for the generators. And if that's what they're sort of relying on, we could be in trouble.
And I think we also need to stock up and we need to ensure that there is enough medication, food, and water to get through any extended heat wave. And here's the important thing, it's also crucial that we have enough staff to deal with surges. So we're not only stocking up on food, medication, and all of that, but I think in literal sense, we need to stock up and make sure we have backup medical staff on hand. So the question to ask is, will the current infrastructure work in the heat predicted by climate scientists? Are we prepared for all eventualities when we face an extended heat event?
Yeah. And from all I'm saying, no, we're not.
Uncommon courage, uncommon